often approaches us. We usually think about how dangerous and harmful it can be and avoid it. News around us paints a grim picture around cannabis. Unfortunately, this is not the case. There are more exposed lies than truths surrounding the control and use of marijuana. The use of marijuana is both ethical and moral in the treatment of both medical issues and pain management. Opioid misuse contributes to a huge health problem and has many negative outcomes. Today, opioids still remain the most used painkillers despite the risk. Opioids are a class of drugs used to reduce pain and include prescriptions like heroin, synthetic opioids like fentanyl. Marijuana is used as an alternative to opioids to manage pain in cancer patients and other chronic pain conditions. Researchers found that more than half of people who use cannabis to manage their chronic pain reported that cannabis led them to decrease their use of prescription opioids, prescription non-opioids, or over-the-counter pain medications. It is more ethical to allow doctors and patients to prescribe, purchase, or grow marijuana without fear of criminal prosecution than the dollars spent on housing individuals in jails and prisons. I picked this topic due to my grandmother and mother fighting cancer. My mom is currently fighting breast cancer, and my grandmother lost her 5-year battle recently to colon cancer. My uncle was also addicted to opioids for many years and now thankfully is clean. I found this topic important to share with my audience because the United States is experiencing an opioid crisis due to the medications being the only legal options for doctors to prescribe for chronic pain conditions and other medical issues. Today, I will persuade my classmates about 2 main topics with multiple subpoints. As a whole, I want to persuade my audience that using marijuana for pain management is ethically and morally justifiable. First, I will persuade my audience on the ethical arguments that support medical marijuana for pain management, and then secondly, I will persuade my audience on the moral arguments that support medical marijuana for the pain management. First, let's discuss the ethical arguments. According to the use of medical marijuana in cancer by Shauna Burchill, she states, in cancer care, medical marijuana presents a clinical continuum for the individual, physician, and the oncology community as a whole. Marijuana use doesn't just help cancer, but it also helps epilepsy, Crohn's disease, multiple sclerosis, and post-traumatic stress disorder. In the same article, The Use of Medical Marijuana in Cancer, Kamer's review article provides summary tables comparing the research to date on effect of smoking marijuana while on chemotherapy. This reduces nausea, vomiting, pain, appetite, and weight loss. On top of that, a different article from Carlsbad, Legalizing Marijuana Would Benefit the Economy and More, states that THC and CBD can kill cancer cells and stunt their growth. Marijuana can safely treat cancer by slowing the growth and reducing the spread of cancer cells. HIV patients have shown that it has improved their food and liquid intake. Doctors have an ethical obligation to seek the most favorable treatment with the best potential outcomes and the least amount of side effects. Doctors can monitor the dosage and side effects of marijuana they prescribe for patients. This allows doctors to manage the marijuana use and encourages an open dialogue between the patients and physicians instead of patients seeking marijuana outside of the medicine practice. This allows patients not to fear about any other substances being in the marijuana they purchase. Secondly, let's talk about the moral arguments that support medical marijuana. If marijuana was allowed to be sold by prescription, people would put a tax on that product. In this article, Study Examines Benefit of Legalizing Marijuana by Emily Doe, a study was founded in Illinois. This study said discriminating marijuana would create about 26,000 new businesses, 2,400 jobs, and generate $525 million annual tax revenue, as well as decrease opioid addiction by 33%. Money earned from these sales could use this to research cures for disease like cancer, which marijuana treats. Jobs would increase in stores, but also within the farming industry to allow more households to gain employment. In the article, The Pros and Cons of Legalizing Cannabis Federally, published in 2022, Collins states, as of right now, there are 35 states that cannabis is legalized at a medical level. Furthermore, Collins states, with marijuana federalized legally, not only would the government see a substantial growth in tax revenue that is projected in the billions, more importantly, people would be liberated from prisons over crime, including illegal drug in nearly half the states in the country. Those patients would now have their pain or nausea under control and may return to work to help support their families and themselves. Many cancer patients or those who cannot work due to chronic pain or other medical conditions incur debt due to the high cost of medical treatment. Having to purchase marijuana illegally funds criminals like drug dealers and risks patients or their family members being arrested and jailed or even given high fines for possession. Allowing patients to use marijuana would decrease some patients being arrested, fined, and sometimes incarcerated. Now prisons would become less crowded and require resources and a smaller percent of tax dollars. Additionally, drug dealers would make less profit from their customers. Stores would sell greater amounts of knowledge knowing exactly where it came from, unlike the dealers, so the dealers would slowly fade out and crimes would decrease. High fines for possession may increase money for local governments, but penalize patients and their families for purchasing the products. Many people end up fleeing a scene if they have the possession of marijuana. In the last campaign city council meeting, council members voted to have a second session to consider changing the minimum fine for possessing 10 grams or less from $50 to $350. Patients don't have any extra money to be spending on paying a high fine like this. It might elevate somebody going to jail, but many patients already struggle financially because they cannot work or have mounting debt due to medical bills. The moral thing to do is to make patients' quality of life better, not worse. Fines, incarceration, fear of arrest, risking the quality of marijuana because you buy it on the street is not how we should be treating some of the most valuable people. As you can see, there are both moral and ethical reasons to use marijuana for medical reasons that contribute to overall quality of life for patients, but additionally incentives for society as a whole. The use of marijuana is moral and ethical for medical reasons, which include treatment and pain management, job growth, decreased population in our prisons and jails, and lastly, treating children and adults in a humane way. As a whole, I want to persuade my audience that using marijuana for pain management is ethically and morally justifiable. Not only can marijuana be used to treat illnesses, minimize chronic pain, decrease addiction and overdoses, but it can also help decrease prisons and jail populations and help our economy's debt while creating jobs for thousands of people. The moral and ethical choice is to allow marijuana to be prescribed to patients so that all those benefits mentioned before can flow. Consider this final appeal. Just because marijuana is illegal does not make it immoral. Opioids are legal, but most of the country now sees that it is immoral to overprescribe them in the dose and duration due to the number of deaths that have occurred and severe addiction that has resulted as a substantial side effect. Thank you.